Harvard Eye Associates Dr. John Hovanesian joins us as he always does once a month, and I want to welcome you back to the show.
Thank you, Michael. Nice to see you. It's another month.
Another month, here we are, and we're talking about some concerns that we've talked about before, cataracts, but also a new study that says there might be a link to early cataracts and dementia, or the progression of dementia.
Yeah, it's really interesting because cognitive impairment or dementia, which is becoming a really increasingly important disease. In fact, the incidence of people or the prevalence of people with dementia, it doubles about every 15 years. And we will have by 2030 around the world something like 150 million people who have dementia. And one of the factors that's been studied is two things that lead to progression or development of dementia: hearing loss and vision loss. So it's important we think about
for
those.
folks maybe not familiar. I mean, I can't imagine you're not familiar, but cataracts, I mean, it's kind of slow fogging of the lens, right?
That's right. Fogging of the lens inside the eye. It's a natural aging process. Dementia is not a natural aging process.
Okay.
It does not have to happen to anybody. And so we should always be on the lookout for ways to prevent it from developing. Having good sensory input, both for our hearing and our eyes, helps to prevent it basically from happening. Significant prevention, something like a 30% reduction in development of Alzheimer's dementia in particular, and really all causes of dementia among people who have quality vision.
Okay, because the first one I heard, I feel like it's comparing Tuesday to ice cream, and I'm like, how are these things connected? But it's one of those things where it's like, if you're not getting the signals, then there's a part of your brain that's kind of getting shut down, and that can kind of increase in dementia?
Right. It's not the first thing you'd think of as a cause of dementia, right? But it is a very important one, and it turns out it's a very real one that's been now well studied in multiple ways with large numbers of patients to establish the link and the importance. And so, the problem is that people with dementia or early dementia often don't complain about poor vision. And their family members may not give it much importance to get them to the eye doctor. They blame their lack of relation to the visual world on their dementia. And there's just sort of this ignoring of what is really an important factor that can influence the progression of the dementia as well and improve quality of life.
Okay. So it was a pretty large study, about 300,000 people or so, and they really saw a real distinction between the folks who had the surgeries and the folks who did not.
That's right. Yeah, well controlled study and a well thought out study that demonstrated this, and it's not alone. There are other studies have shown similar results. So another factor that we think about is so if you do surgery for cataract, in the case of cataract, which is about half of the visual impairment that occurs, some of it is also caused by macular degeneration, which also can be treated. And really, any visual impairment can cause this. So really, the bottom line is you need to see your eye doctor.
Right.
And if you have a treatable form of reduced vision, treat it by all means.
Now, that was going to lead to my next question. How soon, if you start seeing even the early signs of cataracts, is it time that let's just get this done now, or is that always been the recommendation, or does it kind of increase that? Cataract
surgery has always been a procedure that we approach from a standpoint of, well, do you need it? Is it starting to affect your vision? Is it starting to affect your quality of life? And for some people that means, well, gosh, I need to drive after dark in order to get to see my grandkids. Well, if that's impaired, then it's time to do surgery. For other people, those with concern for dementia, it might be at a different stage where they're concerned about it. So, it's a very personal thing, and we talk with every patient about that to make a decision about when's the right time for cataract surgery.
Does the study indicate that once you've had the cataract surgery, there's a slowing of the dementia that's already progressed, or is there any kind of effect there?
There's less clear evidence that removing cataracts stops the progression of dementia that's already started, but it only stands to reason that it would. Right? Having better visual input is going to help people relate to the world better. So it depends upon on the cause of the dementia and how severe it is when it begins, when cataract surgery is done, in the case of cataract surgery.
When you see this in patients, when you see someone coming with a cataracts, are you asking these questions, or do you ask loved ones or their caretakers, something like that? Hey, is there dementia? Or do you try to find there's a connection there?
We do. As part of a medical history that we take, we ask about memory loss and other signs and symptoms of dementia. And that might prompt us to suggest surgery a little bit earlier. Very often we have family members bringing someone in who's got a cataract in there. They sort of have their hands full taking care of someone, particularly if they've got moderate dementia. And so the question is, geez, do I need to take care of this? And you know what? You should.
Okay.
You should. And they very often tell us later that wow, I didn't expect mom to be, relating better to the world and to be functioning better as a result of surgery, but it often happens.
What are some of the early signs that you are developing a cataracts? There are a few of them, or are there just one or two?
It depends on the things you do. So the way I tell patients is that the things that are difficult to see become a little more difficult. So driving at night is a classic example. Probably the most visually challenging task that any of us does, because the world is shades of gray, things are moving fast, there's bright sources of light coming toward us on the freeway, and so everything is set up to make it difficult to see. Reading fine print is another example, particularly in dim light. If you're having more difficulty reading, you need more light to do it. That's usually a sign of cataract. And really anything that visually, I just don't quite see it or feel as confident as I did in the past. Time to get in and have your eyes examined.
Okay, and that clouding, like there's a clarity of vision that goes along with that, right? Do we see the clouding start at the edges, or does it kind of start all over in cataracts?
It varies because there's different types of cataract. With some people's vision on the eye chart is actually preserved very well, but you put them in a car with headlights coming toward them at night, forget about it. They really lose vision. And other people, some people are more sensitive to the visual impairment they get, other people just aren't so bothered by it. So it's very individual. And that's why the discussion is individual, the decision is individual. We never push people into surgery, but we always think about what are the benefits and where is it going to fit in. There's always risk to any procedure as well. I mean, anytime we take the step of doing surgery, we have to accept that there's some risks, that even if the patient does everything right, even if the doctor does everything right, things may not go the way we want. Fortunately, those are very rare. Cataract surgery is one of the most successful and safe procedures done because it's one of the most common procedures done.
And let's take me through the steps of a cataract surgery. Let's say I've gotten to that point and I need it, and I even am at dementia risk, as we've been talking about here. How does that process begin? And you do both eyes at once, one at a time. How does the whole thing work?
Great question. So when we do surgery, there's a little bit of testing in the office we do before going to surgery itself. Surgery is done in an outpatient facility. You're there about an hour, hour and a half for a procedure. You're sedated. We have people lie down. We give them an IV, so they're very relaxed, so nobody's nervous going through it. The eye is numb, and so you may see some light, but you're not going to see instruments moving around or things that are scary. It's over with in about 10 minutes, and you're on your way home. Maybe a little scratchiness in the eye, but no pain, most people say, and they're back to most normal activities the next day. We ask you to wait a week on swinging a golf club or doing any sort of vigorous exercise, but you can walk, you can drive the next day, you can use a computer, you can shower. So there's not a lot of downtime.
And am I patched? Am I covered? Or
for just a couple hours, we have a cover on the eye, and then for a couple of nights, we ask our patients to wear a cover just so they don't accidentally rub their eye while they're sleeping. That can happen.
You do that kind of thing. Oh shoot! I wasn't supposed to touch my nose. Whatever.
Right. Exactly.
And then how long between the one eye and then the other eye, if everything, let's say, goes well?
Often 1 week. The next week, the other eye is done, and people get their lives back. So a lot of people expect it's going to be a lot of downtime and a big interruption in their busy lives, and in fact, it's actually. We don't want to trivialize any surgical procedure, but most people say it's just a real easy event.
Now, besides the clearing of the fogginess and the impaired vision, can you also increase their ability to read? Can you actually improve some of the vision issues they may have been having along with the cataracts?
Oh, there's so much exciting technology today. With lens implants, with cataract surgery, we're putting in a lens that sets your vision for life. It never is going to change after that. And so there's the opportunity to use these advanced technology lenses that are designed to do all kinds of wonderful things. And yes, many patients don't need any glasses at all after surgery. There are costs in that are not covered by insurance. And so, we're never trying to push extra costs on patients, but we want them to understand what their choices are because
there's different levels of lenses in terms of that kind of thing.
That's right. And they're wonderful technologies for folks who want them and can afford them. And it's really exciting what it does for people, but it's a choice that they have. And we want them to understand their choice and then make it according to what's right for them.
Yeah, but Medicare and Medi-Cal covers most of the standard stuff?
Thankfully, they cover the big cost of surgery, which is the operating room and the anesthesia fees and fees for technicians and supplies and all the big cost stuff. That's covered.
Okay, so if I ever get cataracts, I can actually kind of get rid of these maybe someday.
You may well do that.
Now we're talking.
It's pretty exciting, yeah, right.
Dr. John Hovanesian.
They do look good on you, though. So.
Oh, thank you. Well, what can I say back to that? So complimentary. What can I say? The wonderful Dr. John Hovanesian is here. Thank you from Harvard Eye Associates. Appreciate it.
Good to see you, Michael, as always.
Good to see you as well. You're watching This Day. We'll be right back.